There is one number that predicts how long you are going to live more accurately than your cholesterol, more accurately than your blood pressure, more accurately than your resting heart rate, more accurately, in fact, than whether or not you smoke, more accurately than whether or not you have type 2 diabetes, more accurately than whether or not you have established heart disease. One number. And the data on this is not new, the data is not controversial, it has been published in the Journal of the American Medical Association. It has been published in the European Heart Journal. The largest cohort study on this topic followed more than 120,000 people, and the conclusion was unambiguous. The number I am talking about is your VO2 max, your maximal oxygen uptake. It is a measurement of how efficiently your body can take in oxygen, transport it through your bloodstream, and deliver it to your working muscles during peak effort. Most executives I see in clinic have never had it measured properly. Many have never even heard of it. And of the ones who have heard of it, almost none of them know how their own number compares to what is considered optimal for their age. That is what we are going to fix in the next 10 minutes. Before we go further, if this is the kind of content you want more of, please subscribe to the channel. And in the description below this video, you will find a link to my free Executive Longevity Scorecard. 8 minutes. Free. It gives you a personalised read on 6 pillars of longevity, including your physical performance pillar. Link is in the description. Let us get on with it. So why does VO2 max sit at the top of the longevity biomarker pyramid? To understand this, I need to introduce you to a study published in JAMA Network Open in 2018. The lead author was Dr. Kyle Mansager from the Cleveland Clinic. The study followed 122,000 patients who had undergone treadmill testing, and they tracked all-cause mortality over the following decade. What they found was striking. The people in the lowest fitness category had a mortality risk 5.04 times higher than the people in the highest fitness category. To put that number in context, smoking carried a hazard ratio of around 1.4. Having type 2 diabetes carried a hazard ratio of around 1.4. Having established coronary artery disease carried a hazard ratio of around 1.3. Low fitness, measured as low VO2 max, was 3 to 4 times more dangerous than any of those. Read that again. Being unfit was a bigger mortality risk than smoking, diabetes, and existing heart disease combined. The authors concluded, and I am quoting here in my own words, that cardiorespiratory fitness is a modifiable indicator of long-term mortality, and healthcare professionals should encourage patients to achieve and maintain high levels of fitness. That study changed how I think about fitness in my clinical practice. It should change how you think about it too. Let me tell you about a patient. I will call him Andrew. Andrew is a senior partner at a London law firm. He is 54 years old. When he came to see me, he was, by any reasonable measure, doing the right things. He had a personal trainer twice a week. He played golf at the weekends. He walked his dog every morning. He was not overweight. His blood pressure was acceptable. His cholesterol was acceptable. He came to see me because he was tired in the afternoons and he wanted to know why. I asked him a question I ask everyone in my practice. I asked him whether he could climb 4 flights of stairs without stopping and without being breathless at the top. He paused. He thought about it. And then he said honestly, no. He said he had not climbed 4 flights of stairs in a single push in years. He took the lift. Everyone took the lift. I sent him for a proper cardiopulmonary exercise test. The result came back at 28 millilitres of oxygen per kilogram per minute. For a 54-year-old man, that put him in the lowest 20% for his age group. Andrew was not unfit because he was lazy. Andrew was unfit because nothing in his routine was pushing his aerobic system hard enough to maintain it. Twice weekly weight sessions and a weekend round of golf do not maintain VO2 max in your 50s. They maintain strength, they maintain mobility, they do not maintain aerobic capacity. This is the gap that most executives are not seeing. So what should you know about your own VO2 max? First, what the number actually means. VO2 max is measured in millilitres of oxygen per kilogram of body weight per minute. The higher the number, the more efficiently your body is moving oxygen during peak effort. Second, what good looks like. For a 40-year-old man, an average VO2 max is around 35. A good one is above 42. An elite one is above 50. For a 50-year-old man, those numbers shift down by roughly 3 to 4 points per decade. For a 60-year-old man, an average is around 28. A good one is above 35. If you are in your 40s or 50s and your VO2 max is below 30, you are not in average territory. You are in the lowest fitness category from the Cleveland Clinic study, the category with 5 times the mortality risk. Third, how to measure it. The gold standard is a cardiopulmonary exercise test, also called a CPET. You wear a mask, you exercise to maximal effort on a treadmill or bike, and you get a direct measurement. The good news is you do not necessarily need a lab to get a useful estimate. Garmin watches, Apple watches, and Fitbits all provide a VO2 max estimate. It is calculated, not measured, so it has limitations. But for tracking your own trend over time, it is genuinely useful. If your watch estimate is in the low 30s, you should take that seriously. Now the good news. VO2 max is one of the most responsive biomarkers in the human body. You can move it. You can move it quickly. You can move it at any age. The research on this is unambiguous. A meta-analysis published in the British Journal of Sports Medicine in 2019 looked at training interventions across multiple age groups. The conclusion was that targeted aerobic training can produce a 15 to 20% improvement in VO2 max within 12 to 16 weeks. That holds for people in their 40s, it holds for people in their 50s, it holds for people in their 60s. The protocol that produces the largest gains by a clear margin is something called the Norwegian 4x4. 4 minutes of high-intensity effort at around 85 to 95% of your maximum heart rate, followed by 3 minutes of active recovery, repeated 4 times. So you are looking at roughly 28 minutes of work, twice or 3 times a week. You do not need to do it every day. You do not need to be a runner. You can do it on a stationary bike. You can do it on a rowing machine. You can do it on an incline treadmill. What matters is the intensity. What matters is that for those 4-minute intervals, you are working at a level where you genuinely cannot hold a conversation. For my patient Andrew, 12 weeks of 2 times a week 4x4 sessions on top of his existing strength training took his VO2 max from 28 to 34. He moved from the lowest fitness category to the middle category. The mortality risk reduction associated with that shift, based on the Cleveland Clinic data, is enormous. This is the lever. This is the one most executives are not pulling. The reason VO2 max is such a powerful predictor is that it integrates the function of nearly every system that matters for healthy aging. It reflects your heart's ability to pump blood under load. It reflects your lungs' ability to oxygenate that blood. It reflects your vasculature's ability to deliver it. It reflects your mitochondria's ability to use it. When you raise your VO2 max, you are not just getting fitter. You are improving cardiac output, capillary density, mitochondrial efficiency, glucose uptake, and arterial flexibility, all at the same time. This is why the data is so clean. This is why the effect is so large. It is not a marker of one system, it is a marker of every system. The takeaway from this video is simple. If you are 40 or above and you have never had your VO2 max measured properly, you have a blind spot in your longevity picture that almost certainly matters more than anything else you are currently tracking.
Your cholesterol is a useful number, your blood pressure is a useful number, but your VO2 max is the number.
If you want to know where you stand across all 6 pillars of longevity, including your physical performance pillar, where VO2 max sits, take my free Executive Longevity Scorecard. The link is in the description below. It takes 8 minutes, it is free, it gives you a personalised score on 6 pillars, including your exercise and movement pillar, your sleep optimization pillar, your stress management pillar, your metabolic health pillar, your advanced supplementation pillar, and your medical optimization pillar. You will get a personalised PDF report by email. There is no cost. If this video was useful, please subscribe. I publish a new video every Tuesday and Saturday. I am Dr. Mark Holmes. Thank you for watching.